Hello everyone, welcome back to Event 18 of the Impact Club of Cape May County. Sorry we were a little delayed in this quarter's video. We had a couple of technical difficulties with one of the videos. We got it all figured out now, and here's our event. So this is our second quarter event for 2021. We've got two more to go, one in July and one in October. We've been doing good so far, keeping everything together since we haven't been on a Meet Live in over a year now. Hopefully coming up in July or October, it's starting to look like we might be able to meet live in person again, which would be great. I can't wait for that. So far, we have raised over $220,000 for our local Cape May County charities. We want to keep that going as long as we can keep giving at least $10,000 or $12,000 an event. We're going to keep on going forward. With that being said, we're going to have our first video, and it's going to be Cheryl Spalding with the NAACP of Cape May County.
Hello, my name is Cheryl Spalding. I'm the president of the Cape May County NAACP. On February 12, 1909, what is now the nation's oldest and largest grassroots civil rights organization was formed. The NAACP, which stands for the National Association for the Advancement of Colored People, has been a driving force in fighting race-based discrimination in the United States since its founding. In 1909, racial injustices were prevalent. Segregation was legal in many parts of the United States. Employment discrimination was common, and voting rights were often denied. People of color across the country had to live with the fear of racial violence and lynching. And so the NAACP was formed, built on the ideals of another group, the Niagara Movement. W.E.B. Du Bois, along with 29 other prominent African Americans, started the Niagara Movement in 1905. They met near Niagara Falls and wrote a manifesto calling for equal civil rights, the end of racial discrimination, and the full recognition of humanity for people of color. In 1909, many white liberals in New York City joined with some of the Niagara Movement's black intellectual leaders, and from that group, the NAACP was born. In addition to W.E.B. Du Bois, other NAACP founders included Mary Overton, Morphle Story, William Walling, Oswald Villard, Henry Moskowitz, and renowned civil rights leaders Ida B. Wells and Mary Church Terrell. The NAACP's mission has been to achieve a fully integrated society with equal rights for all. Its national leadership has always been interracial, even though the greater membership has been African American. To achieve its mission, the NAACP has not only focused on using the legal system to challenge discrimination, but also on convincing all people of the need for racial equality through speeches, organizing, and legal advocacy. Since its inception, the NAACP has had a long list of legal accomplishments and successes. In 1915, the NAACP was instrumental in outlawing the grandfather clause, which allowed white people to get around literacy tests that were used to prevent people of color from voting in many states. From 1920 to 1938, the organization flew a flag outside its New York City offices with the words, "A man was lynched yesterday," to call attention to the rampant lynching occurring in the United States. In 1954, the NAACP's chief counsel, Thurgood Marshall, successfully argued the case of Brown versus the Board of Education before the Supreme Court, ending the legal segregation of schools. During the Civil Rights Movement, the NAACP co-organized the March on Washington in 1963, where Dr. Martin Luther King delivered his famous speech, "I Have a Dream." And the NAACP lobbied for the 1964 Civil Rights Act, which outlawed discrimination, and the 1965 Voting Rights Act, which made it illegal to deny people the right to vote based on their race. Today, the NAACP remains actively committed to fighting discrimination. Its scope has widened to include fighting inequality in economics, healthcare, education, voter empowerment, and the criminal justice system. Our Cape May County NAACP Chapter 2081, which was chartered in 1952, boasts 202 members, and we follow the lead of the national organization in its vision to achieve a fully integrated society with equal rights for all. Here in Cape May County, we accomplish that by inviting and welcoming everyone to participate as a member of the organization and on any of its active committees. Within the past year, in the midst of a worldwide pandemic and unimaginable social unrest, the Cape May County NAACP has stayed socially distant but very socially active. We've known about the injustices to people of color for over 400 years. But when George Floyd, an African American man from Minneapolis, was murdered by a police officer, kneeling on his neck for almost 9 minutes before our very eyes, enough is enough became our mantra as we peacefully gathered, protested, marched in Cape May, Middle Township, and Wildwood, New Jersey, and stood in solidarity against unwarranted and deadly use of force with other people of color and other races. Following are flyers and pictures of some of the in person and virtual events we've held to engage with and impact the lives of the residents of Cape May County. We are most proud of our 2020 Rock the Vote initiative, where we registered 130 voters, and our Off the Wall initiative, where we were successful in meetings with both the Wildwood and Cape May County housing authorities in removing 234 and 34 names, respectively, from their no trespass list, which had been displayed for more than 20 to 25 years. After further conversation and legal regress, both housing authorities agreed to review and update their policies related to their no trespass list in a more timely manner. The Cape May County NAACP will continue its caring and commitment to the residents of Cape May County while serving as an important legal advocate for all civil rights issues. We thank the Impact Club of Cape May County for providing our nonprofit organization with this opportunity to share the who we are, the why we exist, and the what we do in consideration of being a recipient of your wonderful generosity.
Thank you, Cheryl. Great job. And thanks to the NAACP. Next up, we have Volunteers in Medicine and Jackie Maluda.
Hello, my name is Jackie Maluda. I'm with Volunteers in Medicine. We are a free clinic for the uninsured. Our patients are the working poor. They are our chambermaids, our laborers, our bus staff, and commercial fishermen. They are our neighbors and our friends. They earn too much for Medicaid, but not enough to afford the high cost of premiums, copays, and deductibles. Most live paycheck to paycheck with nothing saved for a rainy day, let alone a global pandemic. I want to share a story about a young girl and then show you a video. A quick word about the video. It was donated to VIM. It is professionally done. It explains who we are much better than I can say. And I know you don't want to look at my face for 3 minutes. So Volunteers in Medicine is part of a global movement. There are 100 VIM clinics around the country, but we're not a franchise and we don't pay dues, nor do we get any money from national. There is no national. So this video talks about Volunteers in Medicine America, but we're not a corporation like the American Red Cross or any of those groups. But back to my story. So we care for a few members of a local Hispanic family. They are a family like your family or my family, a family like we all know, close-knit, couple of brothers and sisters, lots of kids, and a matriarch. The matriarch is very dear to my heart. She reminds me of my grandmother. They call her Abuela. We called mine Babshi. Other than that, same family from a different culture. One day, a few of them presented at the clinic with their neighbors in tow. The neighbors were not our patient. They explained that the daughter of this couple had been feeling poorly for several months. She had been to the ER twice. She had been to her primary care doctor 3 times, and she was no better. They knew something was very wrong. She was listless. She had dropped out of gymnastics. Mom and dad were scared and they were concerned. They asked if we could help. Of course, VIM said yes. That's what we do. Even though she was not our patient, Barbara Harvey, our patient care coordinator, said, "Let me see what I can do." She gathered up all of her, the doctor's reports and visits, the ER, the discharge summary, etc. It's important to note at every one of those 5 visits, there was no translator involved. The medical professional assumed that the ill 12-year-old could translate for mom and dad and manage her appropriate follow-up. So as it turns out, an MRI had been recommended at the ER, but no one ever chased the MRI. The primary care didn't notice it, didn't order it. And although they had insurance, the poor kid never had her MRI. Barbara made sure that that happened. She helped the family with the scheduling. And then the VIM doctors reviewed the results. As it turned out, this little kid had a very bad infection going on inside her belly that was related to a prior appendectomy. She required infused antibiotics. She almost died. And now she's much better. And it's all because of VIM. It's what we do. It's who we are. We listen and we make a difference. And this is all the power of your money in our community. This is the difference that happens thanks to you. So let's roll this video because you don't want to keep hearing from me. I'm going to share my screen and make this happen. Sorry.
Hope. It is listening, understanding, and caring. Hope is as small as a hug and as big as changing someone's life. Some say hope is lost. We say if you treat your neighbor like yourself, you'll always find hope. Hope is one of the greatest gifts one can give to another. Yet in giving it, you also receive it. Hope knows no boundaries. It spreads and strengthens communities. Hope doesn't care about race, religion, or how much money you have. It simply cares. Hope is different because it's never indifferent. We are volunteers in medicine, and we are here to provide hope. We don't just treat people as patients, we treat them as our neighbors. We try to heal them, but more importantly, we try to hear and understand them. We give them medical care, but only after we give them our attention. We care for their illness, but first we care about them. We are volunteers in medicine. We are doctors, nurses, and caregivers. Yet we are also listeners, supporters, confidants, healers, and your neighbors. We are volunteers in medicine, and together we heal.
So thank you for inviting Volunteers in Medicine to your party this quarter. Thank you for choosing us. Thank you for all that you do for the community. Whether or not you vote for VIM tonight, please keep us in mind when you come across that neighbor, that friend, that colleague, that employee who may need access to care. We are a free primary care clinic for the uninsured, and we're embedded into the community to support you. Thank you for all you do, and thank you for being part of the Impact Club.
Thank you, Jackie. Great job. Now for video number 3, we have the Optimist Club of Lower Township, and presenting for them would be Jim Ridgway. Enjoy.
Hello everyone, my name is Jim Ridgway, Vice President of Lower Township Optimist Club. We appreciate the opportunity to present to the wonderful Impact Club at Cape May County, and we thank you again for our nomination here for this upcoming meeting. I'm sitting here today speaking about Lower Township Optimist Club, an organization that I'm involved in, is near and dear to my heart. We're sitting here in front of Lower Township Optimist Field, a field that we supported for years and years. It's just one initiative that we've been involved in our group since 1972. We're approaching on our 50th anniversary for the Lower Township Optimist Club. Started with 8 founding members, one of which is still involved in our crew today. And the initiative to start was just to be friends of youth and to give back to our local community. Just this past year, we were involved in multiple sports teams, including the Lower Township Little League, Lower Township Youth Soccer and Lower Township Youth Basketball, to name a few, as well as the high school's peer leadership program, their backpack program, as well as other groups within the township, because ultimately that is our goal. It was the goal of the 8 founding members and still of our membership today. So we appreciate you taking the time and nominating us. We appreciate any help that you can provide our group. It helps give us to give back money to our locals through our scholarships, multiple sponsorships that we do, and in any other way that we see to keep donating to the youth of Lower Township. We appreciate the time, and thank you again for the nomination. Please reach out if you need anything or have any questions whatsoever.
Thanks, Jim. Great job. Thanks to all 3 organizations for presenting today. We appreciate all that you guys do and all the other nonprofits and charitable organizations in Cape May County. Organizations like that are kind of what hold our community together, helping those in need when they need it, and we appreciate that. It's why we started this Impact Club. Like I said before, we donated over $220,000 so far to our local Cape May County charities, and let's keep that going. Hopefully when we get back to live events, it'll pick back up again, and we can keep driving forward and hit maybe $300,000 next year, and that would be awesome. So thank you everyone for watching. Thank you everyone for participating. We've had a tough last year. I thank everyone who's been sticking with us over the last year. It's that commitment that helps us keep on going and helping our charitable organizations and our nonprofits in our community. And I want to say thank you for that. If they're watching this video, there'll be a link in your email you receive with this video for a ballot. Don't forget to go in that ballot and vote for your favorite nonprofit for this event. And we will announce the recipient of the big check in a couple days. Thank you.